So good morning. My name is Theresa Michele. I'm the Director of the Division of Non-Prescription Drug Products in the Office of New Drugs at CDER at FDA. First off, I'd like to thank all of you for having me here today, and especially to Dr. Parker. It's a great honor to be here to talk about something that's important not just to us in this room, not just to physicians, but important to every single person here in the United States. So I was given a very broad topic about health literacy at the Food and Drug Administration. But in order to focus that a little bit, I'm going to talk not about the past and what's happened over the last 10 years since the IOM report first came out, but instead about the future and some of the things that we are working on right now at FDA, particularly in the area of drugs at CDER, that hopefully will have some impact in the future in this area. I'm going to break my talk into two parts. First off, I'll be talking about prescription drug initiatives, and then I'll turn the tables a little bit and talk about things in the over-the-counter space. As you heard from Dr. Parker, we've come a very long way in the last 10 years, and none of these initiatives could be possible without the work that's gone on in this very room by this group, by many of you in this field. This work also couldn't have happened without some of the paradigm shifts that you heard about from Dr. Coe, thinking about this as a systems issue, thinking about universal precautions, and many of the topics that I'm going to touch on play directly into how those impact what we're doing right now. So I'll start off with the prescription area. And what we've found is that there are sometimes too many cooks in the kitchen. Everybody wants to make sure that patients get clear patient medication information to use, but unfortunately, we're doing this in a whole variety of different ways. So right now, patients receive several different types of information developed by different sources when they pick up their drugs from the pharmacy. These include medication guides, patient package inserts that have been developed in collaboration with FDA for a few drugs, but for the vast majority of drugs, they're also receiving consumer medication information. Many times these may be duplicative, incomplete, difficult to understand, or they may be in direct conflict, which we hope not, but it happens. So FDA right now is considering a new regulation to require all prescription drugs to have a single patient medical information document that will be standardized so they get one piece of paper when they leave the pharmacy. And this would be for every single prescription. The idea is that this isn't a replacement for patient counseling. We obviously still need that, and it's absolutely crucial. But patients need to remember what the doctor told them and figure out when they're home with their drug cabinet, how do I take what when? And importantly, the source of information in this PMI would be FDA-approved professional labeling. We've had a variety of different workshops on this, and for the most part, folks thought this was a generally good idea. So as recently as July, we were reaching out to professionals in the area, and we've learned a lot from all of you, the health literacy researchers who have been engaged in these products with us, as well as a variety of different stakeholders who will play into this PMI effort. Right now, we're currently working on developing this framework. Some of the principles that we plan to work on as part of this is that these PMIs would be developed in much the same way that our prescription labeling is developed now. So the pharmaceutical companies, when a new drug is being approved, would have the opportunity to draft this in conjunction with FDA. And all information would be based on FDA-approved professional labeling. Importantly, we would do something that we now do in the OTC space, but allow consumer testing for comprehension. And this goes back to the idea that we don't assume people understand it. We actually assume they don't understand it until we have evidence that shows otherwise. And when the professional labeling is updated, this information might also be updated. Another effort in the prescription drug world comes out of the FDASIA Act back in 2012, and specifically Section 907 of this act focused on addressing issues related to demographic subgroups in clinical trials. As you heard earlier from our opening speakers, we now have a whole variety of subgroups throughout the United States, the majority of the minority, so to speak. And so the FDA action plan in this area focuses on 3 key priorities: quality, improving the completeness and quality of demographic subgroup data collection, reporting, and analysis from clinical trials; participation, identifying the barriers to subgroup enrollment in clinical trials and trying to break down some of those barriers; and finally, the area that's most pertinent to this group, which is to make that demographic subgroup data more available and transparent, not just to the physicians, but to all of the consumers who are members of various subgroups that might benefit from this information. Fortunately, we have a variety of efforts underway to try to make this a reality. So right now we're working on a website with standardized consumer-friendly format that will be up and running very soon. We currently already post demographic information on our website with each new drug that's approved, but it's really hard to find. You almost have to be an FDA reviewer to figure it out, and that's not very helpful for the general population. So if we have a standardized, simple format for every drug that's easily accessible, that will help people understand what these demographic subgroups and what the data show that may be different. Again, with a focus on how can we get perhaps to a more personalized medicine space. I'm now going to switch out of the prescription field and talk a little bit about the non-prescription drug initiatives, in particular the non-prescription safe use regulatory expansion, which is an area that our division is working very hard on, along with the Office of Medical Policy. In order to explain what this is, I'm going to take a step back and briefly talk about where we are currently and what the issues are with the current system of OTC drug products. So OTC products generally have these characteristics. They have to be adequately labeled such that the consumer can self-diagnose, meaning they have to know they have the condition that the OTC drug is going to treat. They have to be able to self-treat so that they can figure out, how do I dose this, how do I take this, and when should I self-select to use or not use this product. And they have to be able to self-manage their condition. So they have to know, when do I stop use and ask a doctor? What side effects should I expect? When do I expect to get better when I take this product? And furthermore, they have to be able to do this with just what's on the drug facts label. They can't have a health practitioner right there with them who can help them choose what products they should be picking. And finally, even if they get it wrong, the drug has to have a low potential for misuse and abuse. And after they've done all of those things, the safety margin is such that there's a benefit of having this out for the general population across the very broad over-the-counter space. Now, how do we know that people can do this? Well, we test them. And again, this goes back to the idea of universal precautions. We do this primarily with our NDA products and primarily with products that were originally prescription and are now being switched to the over-the-counter space. We have a variety of studies that we look at, including label comprehension, self-selection, actual use studies where we actually give this to patients. and human factor studies. And these studies have evolved significantly over time to become much more sophisticated and much more in line with what we would expect for phase 3 trials in prescription drugs. Currently, we're limited to the space on the drug facts label, and there's not a lot of real estate there. We know that there are a significant public health need for over-the-counter products, particularly since it's difficult to access the health system, and we want to help patients take charge of their own health. As we look to the future of non-prescription drugs, we said, well, what should this look like? And can we provide information in a better way to help consumers make these decisions? And so Ensure was born. The idea behind Ensure is to use innovative technologies and other conditions of safe use beyond the drug facts label to expand which drug products can be considered non-prescription. We've had a lot of communication with stakeholders on this starting back in 2012, and what we found was there were a lot of misconceptions about what Ensure was trying to do. Some people thought that it would eliminate doctor's visits. That's not the intent at all. It's to help people who are sitting in the pharmacy not seeing a doctor, not to stop those who do go to the doctor from going. There's a concern that maybe consumers will incorrectly select the drug products. Again, it goes back to testing. There's also a misperception that FDA is considering the creation of a third class of drugs. This is not the case. Drugs will remain either prescription or non-prescription, even with the Ensure initiative. We're not granting pharmacists prescribing powers. That's done by the states, not by FDA. And we're not trying to make every prescription drug over the counter. There's a lot of prescription drugs that are prescription for a reason, and they should stay that way. What we're trying to do is expand the pie a little bit for those products that could be prescription if people had or non-prescription, if people had the health literacy abilities to understand how to use them. We've had a variety of different workshops to address some of these misperceptions, and we're continuing to engage stakeholders through presentations and expert workshops. I was just speaking with a group of pharmaceutical lawyers last week at the ACI conference on over-the-counter drugs about the Ensure initiative. And we're exploring these options for new regulatory development. So I have a couple of email addresses up here. If you have questions about PMI or Ensure, please direct those to the Office of Medical Policy. You can direct questions or feedback surrounding Section 907 to the steering committee. And I also have a whole lot of websites you can access for additional information on any of these initiatives. So thank you.